Those patients that have kidney failure in the United States are primarily treated by, number one, transplantation, if the patient is a candidate. Number two, in-center hemodialysis. And the third is really home dialysis, which there are two forms. One is peritoneal dialysis, and one is home hemodialysis. Not every patient can do home dialysis. And that's why it's so important that we have all these different options for individual patients. Renal disease itself is the most complicated chronic disease that we know of. There are 807,000 patients that have end-stage kidney disease in the United States. And there are about 79,000 patients that are on peritoneal dialysis and 17,000 on home hemodialysis within the United States.
I developed kidney cancer, it's been about 12 years ago now. In 2021, towards the end of the year, I got really sick and they didn't know really what it was. I was admitted to the hospital. My nephrologist at the time said, he goes, "It's time. You got to go on dialysis." I started off with hemodialysis in center. I'd go in, of course, you weigh in, they take your vitals, then they put the needles in your arm. It was 4 hours out of my day. It really didn't matter when it was 4 hours out of my day. And then I was tired, extremely tired. Now I'm doing peritoneal dialysis, which I absolutely love. It is an every night event, but I sleep through it. So it's not that big of a deal. I would not go back in center unless I absolutely had to. The fact that you do it when you're asleep, I think it's so much easier on your body, and I wake up in the morning and I don't know that I did dialysis. It's just an overall better experience as far as I'm concerned. It's about 20 to 30 minutes to set up the machine. We could go out to dinner. I could come home at, 9 o'clock and be done. It just gives you more of a life, a normal life.
The site of care does matter, and the site of care really should be matched to what the patient needs at that time. Is it in center, or are they able to really care for themselves in the home?
They started me on a treatment called Lasix, which is just a pill to see if they could get the fluid to come out naturally by itself. It worked in the beginning, but then it progressively got worse. During my hospital stay, they discussed the different forms of dialysis that they recommend. Originally, I chose to be at home. In the beginning, I feel that would be the best because you be on your own schedule, do your own time frame. And that way I could still continue to work my regular hours and no interruptions, but eventually that did not work out. At least once a month, you have like 30 boxes delivered to you. And then that takes up like a whole room or a closet or whatever you have room for. That's 30 boxes of solutions. And so that's like kind of daunting. And the bags are heavy. They have it scheduled for 8 hours. So whether you sleep for 8 hours or not, you have to stay hooked up to the machine for 8 hours. So you have to make sure that you have everything aligned so you can't go any further than the cords allow. It's easier to come in here 3 days a week and have them in charge of all the solutions and all the cleaning and everything else. There's a camaraderie to being in the center, and then you have a rapport with the people that are either the techs or the nurses, so you don't feel so alone. When you're at home, you actually do feel alone, like you wonder why this is happening to you.
Public policy has been hugely impactful. I believe that the incentive for legislature to get involved or for the government to get involved, whether it be at the federal level or the state level, rests with a commitment to what's right for the patient. A patient's going to cycle in and out of different therapies, and you select the right therapy based upon what the patient presents with at the time the physician sees the patient. So if you think about what the government's doing right now, I do believe they're on the right track. If we talk specifically about peritoneal dialysis, the shelf life is on average 29 months, plus or minus 22 months. So there is a wide sway of how long patients can remain on the therapy. It's fascinating when you dream about what's possible with home dialysis. We appreciate that there could be far more patients that manage their disease in the home, and we just need to keep moving that forward. But unless you dream and you innovate and you think about possibilities, it's never going to happen.